Just 25 years ago, it was recognized that fulfilling the rights of women and girls lies at the heart of sustainable development. This global consensus was reached by 179 governments at the groundbreaking International Conference on Population and Development in Cairo. Governments recognize that unless women have control over their own sexual and reproductive health, real progress will not be made. Yet while advancements have been remarkable since then, in many countries they have been slow and uneven. At the Nairobi Summit 25 years later, we celebrated a unique opportunity to build on the momentum of the ICPD, Progress in East and Southern Africa. In the past 25 years, East and Southern Africa has witnessed huge progress in 4 transformational results: ending unmet need for contraception, ending preventable maternal deaths, ending gender-based violence and harmful practices, and ending sexual transmission of HIV. Today, 1 in 3 women uses a modern contraceptive method compared to less than 1 in 10 in 1994 to reduce unintended pregnancies. 25 years ago, a woman's risk of dying due to complications of pregnancy or childbirth was 1 in 20 in her lifetime. Today, that risk has dropped from 1 in 55. Many countries have criminalized gender-based violence and have outlawed harmful practices like child marriage and female genital mutilation. Since 2010, new HIV infections have declined by 28%, while AIDS-related deaths have decreased by 44%. This progress is impressive, yet if we're to keep the promise of the ICPD made 25 years ago, the renewed commitments made at the Nairobi Summit in 2019 are key to addressing the gaps that remain. Barriers to progress. Despite the reduction in poverty, there are rising inequalities. There are high socioeconomic inequalities in Namibia, South Africa, Botswana, and Lesotho, for example. When it comes to accessing sexual and reproductive health services and information, like modern contraceptives and maternal health services, the poorest and most vulnerable people face the greatest challenges and carry a disproportionate burden of negative health outcomes. Gender-based violence is rising, with 45% of women in Africa having experienced physical or sexual violence in their lifetime. Commitments made in 2019. At the Nairobi Summit, more than 180 governments, civil society representatives, the private sector, and youth mobilized energy towards the revolutionary ICPD agenda. The summit generated more than 1,200 commitments by governments and international and national partner organizations towards achieving the ICPD program of action. The majority are linked to the SDGs 3, 5, 10, and 17. They are to be achieved by 2030. If we want a more equal and prosperous world, one with 0 preventable maternal deaths, 0 unmet need for contraception, 0 sexual and gender-based violence, and 0 sexual transmission of HIV, fulfillment of these commitments is critical. With a growing population of young adults of working age relative to dependents, countries also stand to harness a substantial economic benefit or demographic dividend that can lift families and whole communities out of poverty. Of the 1,200 commitments, more than 1/5 of them came from East and Southern Africa, which is a great testament to the importance of the work that lies ahead of us globally and in the region. Most of the commitments relate to universal access to comprehensive sexual and reproductive health and rights, and better implementation of the ICPD program of action. When we talk of sexual and reproductive health and rights, we mean improving care during pregnancy, delivery and post-delivery for women, and care for newborn babies, providing high-quality family planning services and infertility treatment, eliminating unsafe abortions, combating sexually transmitted diseases, especially HIV, and gynecological morbidities such as cervical cancer, promoting sexual health, including comprehensive sexuality education and menstrual health management, and care for survivors of sexual and gender-based violence and harmful practices such as child marriage and female genital mutilation. Examples of the bold commitments made by countries in the region are Civil society organizations in the Southern African Development Community committed to placing HIV as central to sexual and reproductive health and rights in Southern Africa, as well as advocating for decreasing HIV incidence and prevalence rates and HIV and AIDS mortality rates. The government of Malawi has committed to lowering the country's maternal mortality rate from 439 deaths per 100,000 live births in 2016 to 70 per 100,000 live births by 2030. The South African government has committed to allocating $79 million to fight gender-based violence. The Tanzanian government committed to increasing the percentage of health facilities providing adolescent and youth-friendly services for in- and out-of-school youth from 30% to 80% by 2030. Action. Countries have been working hard to fulfill the promise of the ICPD agenda, and together we need to work even harder to accelerate progress. By giving women equal opportunities and the freedom to control their own bodies, and by ensuring universal access to sexual and reproductive health and rights, we can make sure no one is left behind. It is time to accelerate action to deliver on the promise that we made to women and girls 25 years ago. We owe this to our young people now.